Although alcohol and drug abuse remain common, the use of mixtures and other illicit drugs has seen a rise during the lockdown implemented in Stage 1 of the state of emergency. Government had banned the buying and selling of alcohol altogether.
So what is happening now is that during the time that was locked down, people were drinking whatever they had and even the cheaper and mixing. So the complications and the signs that we were getting at the hospital wasn't a good sign to see. Then we look at the ones that that were already taking the substance has been in sobriety, meaning they have been abstaining. Now, because we are limiting the movements, it means that even the AA meetings and NA meetings that they used to go for socializing, to at least interact with a group that was understanding them, is now limited. So this also is forcing them to have a relapse or lapse.
Substance abuse has mostly been observed among the 15 to 40-year-olds. The worry among the mental health experts is that the affected persons are unlikely to seek help. This owing to stigma and myths surrounding the substance abuse, which the panelists debunked.
I think there is help out there. People just need to access it, and they need to know that it's okay to access it. It doesn't make you weak. It doesn't mean you have a character flaw. Jackson was talking about the myth that it's a choice. It's not a choice. We know that it's a brain disorder. So, and I think when we put it to people in that way, to say, you know what, this is actually a disorder, same way that hypertension, diabetes, or, any other disorder is what we call a medical disorder. This is also something that we look in that category. And it takes away that stigma that people often feel regarding that mental illness.
3 in 4 patients that we see, they have a substance related disorder as well. So that's almost 75% of all the patients that we are seeing. And that, if we were to put it into context, we find that there's only 2 centers that cater for psychiatry in Namibia. The one in Oshakati and the one in Windhoek. And if that's the case, then that means 75% of patients or cases that they are seeing there, they have a related substance use disorder, which shows that there is a huge need when it comes to substance issues.
The panel, which discussed addictions and substance abuse during COVID-19, further recommended to family members that they not outcast those suffering from addictions, especially when such individuals are under treatment. Blanche Koreses, NBC News, Windhoek.